Hi, I'm Gregory Raglow. I'm a family physician and the Group Health Informatics Director for SEHA, which is the government health system in Abu Dhabi. I've been here since 2012 working on our Malafi system, which is our electronic health record.
Thank you, Dr. Greg. What are some of the challenges in transitioning a hospital into a paperless hospital?
It's very difficult to do because paper still forms a big part of medical care. Patients go home with papers, and so what we have to do is be able to scan in everything that comes in and be able to produce in some way something for patients to go home with, and we're not quite to the point where we can be completely paperless. However, we can be paper light, and some of the challenges with that are the way that paper is used. It has multiple functions. Take an x-ray form. You might be filling out the patient's information, what order you want for the x-ray. The location is on the back with a map and a phone number for the patient, so that's patient information. You might put it in a door and say this patient's next, so it also arranges that. And so all of those functions have to be taken account of when you're transitioning to a non-paper system.
And what are some of the obstacles in maintaining electronic health records?
Well, there's constant change. We have to map to our clinical workflows, and anything you change in the system for, say, the doctors may change the system for the nurses and different specialties. And so we have to have robust change management, change control system, so that the change is not going to negatively impact the other parties that are playing in the same sandbox. So those are the ways we have to do governance, which slows change down quite a bit. The other thing is that there are the resources are becoming more and more scarce. As electronic records roll out, those resources have opportunities, human resources, to further their careers, and so you have to treat your staff very carefully to keep them on board.
How important is the role of health informatics in moving the healthcare industry forward in this region?
I don't think I can underestimate how important health informatics is. In our system, every order, every record is in our electronic health system. So everything I know about the patient beforehand is in there, and everything that gets done for the patient gets done and transmitted through this system. And these systems are trying to map to very complex processes. So informatics tries to bridge the gap between clinicians and the IT systems that are using the systems. And we have to train clinicians to use the systems properly in order for us to get the benefits. We also have to be able to understand the data that is coming out of that through health analytics, and understand the sources of data, the potential sources of error, and be able to drill down into the details so that we understand what is our system telling us.
How do you see the GCC Healthcare Innovation Congress contributing to the healthcare industry in the region?
The GCC Healthcare Congress, Healthcare Innovation Congress, brings leaders from across the region to discuss the issues of the day with regard to health informatics and IT systems in complex medical systems throughout the region. And that networking is important, as well as the plenaries that we attend.
Okay. And in your own words, what can you tell your colleagues and peers in the industry about attending this event?
I'd like to welcome my peers and colleagues to the GCC Healthcare Innovation Congress and invite them to participate in our discussions and allow us to get to know one another, because I think this is an important time in the history of informatics, and we need to work together to change healthcare for the better.
Thank you, Dr. Greg, for your time, and we look forward to your presentation at the event.